And I'm Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
Sure, you had to ruin it right away, Brad. I was thinking we really were, so. Okay, what are we going to talk about to the folks today, Brad?
Well, this is something that in the clinic we both use on a regular basis, and sort of many therapists as well as some chiropractors, and that is the use of the ultrasound, and we're going to go one step further and do phonophoresis as we have up here. And don't get scared. I talk to patients, I say, we could try some phonophoresis, you know, on your shoulder or your elbow, and they look at me like, phonophoresis?
It sounds like a very terrible word, doesn't it?
Right, yeah.
Intimidating word.
Right, so let's break it down and
sure.
Find out what exactly phonophoresis really means.
All right, well, phono just means sound, and I'm sure in this instance, they're actually just referring to the ultrasound,
right,
which are ultrasound waves. Which, by the way, we should mention, many of people have heard of ultrasound, but they think of it in terms of, you know, they use it to diagnosis as far as, or looking at their baby or,
right,
or something.
Pregnancy, or looking for a blood clot type of a thing. This is a different type of...
This is treatment ultrasound. This is not diagnostic ultrasound. So we're actually using the waves to treat as opposed to diagnose.
Right. So we know what phono is, and what about this phoresis?
Phoresis means transmission. So what we're trying to do is transmit normal topical medication, and we're trying to transmit it through the skin deep down into the tissues. So we're going to use this machine to do that, and this is a simulation of the ultrasound head.
Yeah, so this is the actual ultrasound head that we would use. As you see, connects up to the primary unit that generates the energy for the unit.
And there's a little crystal in there. Yeah. Vibrates real rapidly and creates ultrasound waves. Right. Now we can use this machine just to provide heat, deep heat. In fact, it can heat up to the point where it actually can heat up the outer layer of your bone.
That's not fun.
That's not fun, no. But the cool thing about this is, you know, as it pushes the medicine in, it's totally painless. So there's no, I mean, the idea here is that you might use this instead of getting a shot. Like if you're thinking about getting a cortisone shot for some type of inflammation you have, this would be something that would be better to try first.
Right.
And generally, the disadvantage I would say is that it takes usually several treatments before it is successful. Right. What I typically tell patients is that if it hasn't gotten better in three treatments, I mean that we haven't seen any improvement, then it probably isn't going to help.
Right.
If it has helped after 3 treatments, I'll go on and do more treatments after that, but is that your case?
Yeah, and I like to go 3 times a week. I like to do a Monday, Wednesday, Friday. Spread it out to the week if that fits. And of course, every case is a little different, but these are some general rules.
So again, yeah, what we got here is, do you got the black marker?
Yes, I've got it right here.
So Bob. This is, well, so we put down a gel, which actually the ultrasound in order to work has to have a gel. But the gel is mixed in with the type of medicine we're going to use. And there's different types of medicines we use.
We had some gel.
The gel's over there.
Oh.
Anyway, so we lay down this gel on the surface of the skin. You know, this is your body or body part here. And this head then, here comes the gel.
Throw it in.
That's one of the gels. Yeah, that's gel without the medicine in, and this is gel with the medicine in. So anyway, the head of the ultrasound would actually rub, you know, it rubs on the skin and it actually drives the medicine down into the surface, opens the capillaries so that they can take the medicine and bring it down. Now, I've read, and this has been a long time since I've read this, but that it can go down as much as 5 centimeters.
That's quite
which is a lot, which is 2 inches.
Right.
So I mean, you think about that, you know, whatever body part you do, if you're driving that medicine down 2 inches, that's deep.
Right.
And it's a lot deeper than what normally, if you just took Aspercreme or some other medication to put on there. We're always using an anti-inflammatory medication. It's very important what type of medicine you use, because certain medicines can work with the ultrasound, and certain medicines will, you know, are better for driving through the skin. There's a certain combination that you need to fulfill both of those. I want to give just a personal story. I know I'm talking more than you, Brad.
Yeah, I'm really agitated.
Yeah, he's ready to go.
Go on, tell me a story.
But he didn't have a personal story, but I hurt my foot once on a runner, and I was putting up with this for, I would say, a month. and I was icing it, and it just was not getting better. Finally, I'm thinking, I'm a therapist, why am I doing this? I did some ultrasound, I swear to God, that thing got better in 2 days. I mean, it was amazing.
What part of your foot?
Right on top of my foot. It was a weird injury.
Really?
Yeah, it was just,
Weird.
it was really inflamed, and this just, you know, of course, because I'm a therapist and I have a machine, I did it twice in 1 day and a third time in, you know, the second day.
Right.
So, I mean, but it got better fast. What are some, Brad, since you want to talk here,
Yeah.
you can look, contraindications. Where are places that you're not going to do this?
Well, I just have them memorized, Bob.
Watch his eyes.
When you do it close over the bone, like if you have an injury by the knuckle or on the elbow where the bone is right under the skin, I don't do it there because I've actually tested myself with that. When you ultrasound over a bone and you hold there, it's very uncomfortable, and you don't want to do that to a bone. If the person has a history of cancer in that area, you can stay away from that.
Sure.
Any open skin, you're going to stay away from that. I really think we should show them little,
Well, you don't want to mention these other ones? You don't want to do it over breast implants.
No.
You don't want to do it over epiphyseal plates, in other words, growth plates.
So younger people.
Eyes, cancer, as you mentioned, pacemakers, that's a big one.
Yeah.
Thrombophlebitis, and a laminectomy site. So, all right.
That's on the back where you have after back surgery.
Yeah, anything else, Brad? Otherwise, we'll go right into showing how to use it on this specific site.
Over the eye, huh?
Yeah,
Over the eye.
that would be something. So we're going to talk about use of the phonophoresis on the knee. And generally, again, as we mentioned earlier, this is generally for some type of inflammation. And we like to refer to it as the itises. Itis. Arthritis, bursitis, tendonitis.
Which, as we were breaking down the things before talking about phonophoresis, what that means, if you have arthritis, itis is inflammation, arth refers to a joint, so inflammation of a joint.
Right.
Tendonitis, inflammation of a tendon. You break these things down and it's not so scary sounding.
Yeah, bursitis, there's a bursa, which is a fluid-filled sac that gets inflamed. Either way, we're trying to calm the inflammation down. The advantage of the ultrasound over a cortisone shot is that, one, that it doesn't hurt. This doesn't hurt at all. And two, a cortisone shot, you're limited on how many you can have a year.
Right.
And that's because there is some side effects to cortisone, which, I mean, we won't go into, but there's, a downside to it.
The other big benefit we haven't mentioned is with phonophoresis is you almost always get it from a physical therapist, and a physical therapist is almost always going to give you other things that you can do
right,
at
along
home.
with it.
Whether it's ice massage, some cryotherapy, some stretches, some strengthening. You're gonna come in for the treatment, and what else can you do? What are you doing to irritate it? It might be an activity you're doing you're not aware of. You eliminate that, and that can really make some dramatic improvements as well.
Exactly. So all in one package. All right, we're going to show it on the knee.
Right.
All right. It's a fine looking knee, huh, Brad?
Oh God, Bob, I haven't seen a knee like that for a long time. I'm going to call home and talk about that.
Watch out for still some gel in there. All right. I want to talk about the different, this is just a gel without the medicine in. Ultrasound, if you were going to apply it and just use the heat aspect of it, you would just apply this gel. It's a coupling agent which helps transmit the waves. You don't need to know all that. This, by the way, this is actually the one with the medicine, and it has the gel and the medicine. Ketoprofen is what we use. There's also other medications you can use, hydrocortisone cream, also dexamethasone. We've seemed to have the best luck with the ketoprofen, and that's why we use that, a good anti-inflammatory gel. All right.
Okay. So in this case, we're going to, obviously he doesn't have knee pain now, but in this case we're going to use it here. You're probably not going to go right over the kneecap where you got bone right under the skin. That's where you typically stay away from. And
I always tell people, if you want to find the joint of the knee, you just take your hand and go like that. That's the joint. So if I was having arthritis, it'd be the joint. There's a bursa here that a lot of people get pain there, the pes anserinus bursa. So if you're having pain right here, that might be it.
That's a big term too.
Yeah, we like to impress people.
Pes anserinus, yes. Okay, let's get going with the treatment here. We're gonna get some of the gel out. It always makes those funny noises.
Yeah.
So act professional.
And as Brad said, it can, before, and when we were talking about a different body part, it actually can be cold unless your therapist has been kind enough to warm it up for you a little bit, but.
This particular ultrasound head, I really like it, because if it's on in the morning when you come into work and it's on for a while, it's actually the head heats up.
Oh, it
so
does.
It's warm.
Yeah.
And sometimes, you know, if the therapist is real nice, they'll heat up the gel before they put it on. It feels warm, especially in the winter time. That's kind of a nice little thing. It just makes the first initial contact feel better. But other than that, you're not really going to feel too much. The intensity when you do phonophoresis is not too high. Even with ultrasound, if the intention is to get heat, and it's a gentle warmth. People enjoy ultrasound
Right, they
treatments.
generally like ultrasound. It's
Yeah.
not worrisome like a shot. The thing I like about it versus a shot too is we can cover a large area. With the shot, they're trying to get a specific spot, and if they don't get it, it's not going to help. So the ultrasound can, you know, we can kind of hedge our bet here and cover a large area. Generally, treatments run about 7 minutes. That's what generally Brad and I do.
Yeah.
And I tell people that if it hasn't helped by the third treatment, you know, somewhat, if it's not even improved at all by the third treatment, it's probably not going to help. So if it has helped, then we'll do some more after that.
Right.
But Brad was just mentioning a case here where he had a guy that got better in 6 treatments, and I think that's not unusual for me to see.
Yeah, and he was improving after the second visit. There was some improvement, and it was only feeling better. In his case, his strength, because the muscle that was working, it was limited by the pain, and the strength was clearly getting better, measurably. So.
So again, this is going to be a lot better than just taking a topical, you know, analgesic, I guess they call it, and you apply it yourself. This is going to push it in.
Right.
So.
Yeah.
All right.
Can I be done now, Bob?
I'm done.
Okay.
Feels good.